thank you very much for the opportunity. And yes, it has been a little bit hospital-centric, the discussion to date. And I'll just reiterate that for most of you, 95% of healthcare happens outside hospital. So just sort of say that. Is it 94? Anyway, it's a number like that. And as Pip said, WAFA is 10 months old. Sitting at a table over there is a chair of one of our community engagement committees, Tony Adderscott, who could just wave. And some of the things I'm going to say you can blame him for because we had some lengthy... No. We had lengthy discussions...
It's very consumer engagement.
Yeah, it is, isn't it? Well, he gets enough airtime. We had a co-design process in developing WAFA and the PHNs, and therefore Tony was one of the voices that said these are the things that are important. So I'll just sort of couch a couple of those because it might just help. So, as Pip said, we are a commissioner, we're a funder of services, a planner of services. Our remit is primary care with a focus on that group of people who might go to hospital a little more often than we would like, that could be well cared for in the community. So we have a remit that's about keeping people well in the community, and our footprint includes WACS, Perth North and Perth South, and the hospitals therein, as well as all the other providers. I think it's probably important to say that the primary care sector, while the opportunity is there to measure outcomes and patient experience, because it's so fragmented, it probably hasn't happened in the coordinated way that you hear can happen inside a hospital, where the reach is to thousands of people on any good day. And of course, GPs, through their accreditation, while they're required to do a survey of their patients as part of accreditation, it probably doesn't capture what you might say is a patient experience in terms of the information. That is a beginning changing environment, I have to say, and I think we'll see that change over the next few years. Anyway, so hold that thought too. But we take a differing view about patient experience. Our view is, while there's a strong safety and quality agenda, and that matters, what really matters to us is what matters to the patient. And sometimes that's a very different thing, as we've heard said, to what matters to the clinician. So we are moving forward in a way that measures both the person's experience of the care, so did they experience it okay, but also what are the outcomes that matter to them. And in your case it was someone said, let's do surgery a little bit quicker, rather than the clinical outcomes. So we know that clinicians are bothered about clinical outcomes. We need to be focused on that, but simultaneously focused on the patient or the consumer's outcomes and bring that together. We think the sort of challenge for us is to create the information that allows the clinician to have a different conversation with the patient. So bring together the outcomes, my experience of that care, with the clinical data, and then start the conversation. So this might sound a little bit posh, but at the moment in the sort of sector, you can see a divide between clinical outcomes and patient outcomes. In effect, they go hand in glove. They're not necessarily separate. And we want to bring that information together for GPs and other providers so that when they're talking with their clients, consumers and patients, they're bringing together clinical experience as well as the patient's experience and outcomes of care. So our role will be, we're going to do patient opinion, as I let Melissa know about half an hour ago, in the country, because we think it's important to have communities where the whole community service provision, primary care and acute, has patient opinion. Because if you're being referred by the country hospital to the physio down the road, you'd want to think that the same person who's going to the hospital, who's going to the physio, can also put up, it's exactly the same platform. So anyway, I say that. I think the other thing to think about in reporting on consumer outcomes is I think we're at sort of beginnings of tipping points here. The more people who, for example, use patient opinion, the more it will get used. The more people who have a shared record and provide their own experience of their care, the more it will get used. It's only the consumers that are going to change that. Clinicians can't make that happen. It's people who use services, who want to provide feedback, who want to hold their record, will make those changes. So our view is this is about empowering communities to do this, as well as working with clinicians. There's sort of two sides to this coin. So taking both clinicians on the journey, but also helping consumers have a place to have a say. So everything we fund will have built into that a requirement that the patient or consumer's experience and outcome is measured, so that we can start to collate that information in a way that starts to inform the models of care and practice. At the moment, that connection isn't as strong as we would like. And from our perspective, if the value for the patient means X, we've got to consider that when we're designing new services. So I think we are at a changing environment. We're moving, I think, from a safety and quality driven, we want to hear what the patient says, to creating value, creating models of care that make sense for the person who's going to use the care. So I guess my take home to you is it's both clinically driven, but it's also got to be patient measured outcomes that start to influence what happens, so that we actually get not only good care, good value, but we'll see experiences of care start to change. So again, we're in primary care, different beast to the hospital, but in doing it in partnership, so we work a lot with Royal Perth. If we do these things in partnership, it'll feel a bit more seamless for the person who has to move between primary care and a hospital and back out again, rather than very separate silos. So, because really, for us, consumers, we actually don't care, do we? We just want good care, we want good quality care, we want to be able to move seamlessly. Therefore, how we measure outcomes and how you as people put in input to that also becomes important. So the jargon is PREMS and PROMs, patient reported experience measures, and effectively that's what patient opinion does. It picks up your experience of your care, and then there are patient reported outcome measures which really get to the individual saying, these are the outcomes I wanted from my care. I'll say this, Tony's heard it before, I want my shoulder fixed because I want to get back on my bike quickly, and I want that to happen safely and effectively and easily. And that's what matters to me. But what will matter to someone else may be different, and we've got to start to capture what matters to the patient and the service user and start to create that dialogue with clinicians about talking through with the person what matters to them most.
Thank you.